gap. And one of the panelists that we had at our Elder Law Forum is here today, and that is Fred Erlich. And Fred is the founder and CEO of Living Resources. Good morning, Fred.
Thank you, Lou.
And Fred's going to update us on Living Resources experience because they are one of those employers trying to find home health workers.
Well, thank you very much, Lou, and God bless you for being out there and practicing law. And we're going to
I could use a blessing every now and then. Thank you.
More of that. Just to recap, Living Resources, we, in terms of the workforce, we basically need 1,000 employees to run our agency. Mm-hmm. Right now, we have 800 employees, and we have 200 employee hours done in overtime by people that are working very hard to fill those hours because they're all essential hours. If we fall below those hours, the state considers us neglectful and we have to report it. So that's what the Justice Center came in and they set up this, you must have this many people or you have to report it. So it's not like we could leave jobs open. We have to fill them even with overtime. So as an agency, I was doing some simple math, and I don't want to just, if this is helpful, I'll just go down this track.
Absolutely.
So we have to do 5,000 hours a day of work to serve these 2,500 people we have in our care. Our extended care, either they're living at home or they're in our group homes or day services or whatever, supported employment, whatever we're doing. And we're very efficient. We can't be more efficient. We're at less than a 1%, like a 0.5% is our profit loss. We're up to about a $48 million budget, and we're running about a $100,000 surplus.
So you're on a thin margin.
Yeah, we're on very thin.
Consumer directed was 0.3%.
Yeah, right.
You're at 0.5%. So it isn't like there's money to flush through the system. It's just not there.
That's right. So we're spending more and more of our money that we receive for direct support and supervisors and clinicians. Mm-hmm. Our administration is around 12%. So we're actively involved we are getting staff. We have a lot of, every 3 weeks we run a class, and I always go into orientation, and we had about 15, that's a good number of people that are in this class. So we're out recruiting, we're out working on the wage issue, which is hard because our funds are fairly fixed.
Right.
The state sets our rates, and if we don't like the rates, too bad, live with it or go out of business.
Yes.
There's not a lot of support there, I gotta tell you.
So who are your competitors? Not just competitors in your field, but competitors in other industries and other employers that are competing for the same
right. And anyone in retail, in healthcare, human service care,
so
CVS,
does the holiday season affect you because
stewards,
the retailers are all hiring up for holidays?
The worst time is the summer because a lot of our people want vacation as well. And especially in August when people are going, my kids are going back to school. I got to get some vacation in. I want to see them. So these 2 weeks, I do a lot of hand holding. It's always hard these last 2 weeks of August.
Do you have to deny vacations to certain people?
We do. No, we don't really deny vacations. It's just that our supervisors and our higher ups work direct care hours. Mm-hmm. People just get in there and do what has to be done.
Right.
So we
there's more overtime than for the people that are still on.
Very strong. We have a very strong machine as an organization. I feel really good about it. So some of the things that we're doing, which I'm excited about, we have a partnership with Schenectady SUNY. They have a new certificate program for 27 hours. and we're an apprentice for the Department of Labor. So anyone who works for us who gets enrolled in this thing, it's free tuition. They don't have to pay anything, and we don't have to chip in. That might go on for a year or two. The Labor Department put some money out there. So we're aggressively going after that. And we're going to help people to get these courses, and we're going to hopefully have some of the courses at our office, online, whatever, help people so we can attract people in that regard.
So training and recruitment is big, and retention, I'm sure, is also an equal issue to recruitment.
Yeah, as I said, the employees in the discussion we had at the conference, I said the employees really need to know that you care about them. A big part is retention. Recruitment is really hard because people look at what's the posted price. Mm-hmm. If we're paying $12 an hour and Stewart's is paying $12.20 an hour, they might go to Stewart's even though we have a very strong healthcare package or tuition reimbursement. They don't.
Stewart's has an ESOP.
That. They have an ESOP. Well, that's a bad
which is an
example.
Employee stock ownership plan, and that helps them in recruitment. So that's private industry, and they have the options of doing things like stock bonuses, and you're just wages.
Right.
We don't have wages. The same incentive programs.
And we don't have let's say everybody gives the McDonald's or such. They could cut back on employees by doing machine intake, kiosking and hit your number and get your order. We can't do that. The people we serve really need care.
Well, let's talk about them for a minute, because the ultimate impact, as with consumer directed, it's individuals who are frail, aging, or disabled who need the help in their homes.
Right.
Who is your population that you serve, and how many clients does Living Resources have?
We have 2,500. So we have a lot of people that have long-term health, long-term developmental disabilities or brain injuries. And we also serve people that are through the licensed and certified home care who are just getting out of the hospital. Mm-hmm. So they're going to we're actually very strong right now in nursing, OT, PT.
So you have a CHA
work. We have a CHA.
Certified Home Health Agency and Elixa?
Yeah, this CHA is very strong, doing very well. The Elixa is a problem because it's the same problem that we have with finding Living Resources workers, mm-hmm. consumer-directed workers. They're all that pool. There's not enough of them.
Right. The CHA is more skilled care.
Skilled care.
And a lot of Medicare reimbursement.
Right. The Medicare is good, but we don't have enough. The part of the CHA which requires home health aides is always weak.
Yeah.
But the professional part, we're actually very strong right now.
And it's that level of worker that is the hands-on personal care aide, home health aide that is missing.
Right. And we keep a lot of people, as I said at our conference. We have 1,500, we have 150 employees that have been here 10 years or longer. And most of them are direct care. Mm-hmm. So we always thank them. We have parties. We try to do more of that. And we also, the healthcare is important.
Right.
And recognition.
Yeah.
Stuff like that.
The spirit of the workforce, especially in this kind of a job, which is a mission. It isn't a factory line. Those are people that you're working for. Has the shortage and the lack of those aides impacted care directly for the consumers?
In terms of if our workers are tired, they can make more errors. They can maybe short. The number of incidents of things is not really going up. We're holding the line on that. But we're getting a lot of younger workers who are less experienced.
Okay.
And that they could be there's a couple more auto accidents, like a fender bender stuff, things that we have to watch out for. So that kind of thing. And, it's really tough, but you've got to, we care about our mission.
Sure.
And we're doing what we can, but, I don't see the state really advancing in their desire to do more of this.
What do you see for 2020? What's your picture of 2020 in terms of this marketplace?
The people that are doing the service have to keep figuring out a better way of doing it. but I don't see the government really saying we need to do more. I think the Elizabeth Martin example is clear. It's like, how could we do the same for less?
With 60% less.
Right.
Yeah.
So whatever. Maybe they'll bargain it down to a lower percent, but there's a cut.
Yeah.
In terms of agencies that provide long-term support for development, they have rate base years, and 2019 is a base year. But with everybody having people getting older and more disabled because they're living longer, we've done
Right.
well at that. I could see every agency coming into the state and say, we lost money, raise our rates, and the state going, we don't have any more money.
So I know
could be
that
a problem.
you and I have had some meetings, and
Yeah.
our staffs have had some meetings on
Right.
technology
Yeah.
and a project that you're working on. Tell our
We
viewers a little bit about that.
We have two projects. One is an overnight support project,
I find that fascinating.
which is getting stronger. We have 6 apartment houses that are into this now, and we have staff overnight watching, doorways through, basically outside, make sure it's safe and all that. And inside the building, there's a direct hit a button and you're talking to a human, to our staff at the office.
Mhm.
And if people need care, we'll send out a responder. So we'll fix it right then and there. We have staff in the field ready to go if we need them.
Okay. So it's a
That
video
part's good.
video
Yeah.
connection that they can initiate from home.
Right. Video and security.
Mhm.
We're working with a security firm. So we have that down. We're not trying to become a mom and pop wiring company.
Right.
So there's and we also, it's a secure network, so it only goes to our office.
Mhm.
The other thing we're doing is we acquired 2 robots, mini robots, through a firm called Misty. And now we're in a project with maybe 20 agencies around the country that are saying what's the use case for these robots. So we're figuring out what are the best uses.
Right.
And then you have to program the uses with JavaScript programmers.
Mhm.
So
And
that's
that's
very
using
far away from
Artificial intelligence
Yes,
to gather information.
right. So the robots are already built in with very strong ability to do direction, to take commands, to, there's some things about facial recognition
Yep.
around moods and all that. I don't know how far that really is going to go, but we're trying to work with people. School of Engineering at UAlbany, Informatics, Public Health,
Mhm.
and a group, CanCode, Albany CanCode, another group of people, just trying to put that all together. And the innovation garages, we're trying to work with technology.
That's super.
Yeah.
Well, Fred,
And
thank
we'll
you.
work with you, of course.
I hope so.
It's always
Thanks for
a
joining
pleasure.
us this
Thank
morning.
You. Thank
And
you.
it's great to hear the Living
Yeah.
Resources is fighting the good fight.
We're going to fight. We're always fighting.
Serving your population. That I don't think is ever going to end for us.